Now listen, we all plan our goals when it comes to career or school, but what about when it comes to having a family? Dr. Maria Manriquez from Maricopa Medical Center's Labor and Delivery Department is here to explain what a reproductive life plan is and why it's so important to have one. Good morning. It's
good morning.
To see you.
Thank you.
Yeah, I think that's the first question is, what is that? Because I thought, did I have one? I don't think so.
So it's really important, and most of us don't. I think the extent that we give thought to our reproductive life plan is whether or not we want to have kids.
Sure, sure.
But it's really important to start thinking as early as possible. I had this talk with my daughter who's starting college.
Really?
And I think she was expecting the contraception talk, but rather it was, let's talk about whether or not you want to have kids someday, how many kids you want to have, and when's the best time to plan to have these children during your life. She wants to go to medical school, and so she was interested to hear me say, wow, Mom, you know, you really think I should be getting married here and thinking about having kids here? And the issue today especially is many women and men are waiting until their 30s and sometimes 40s to start planning, which is not good.
Well, what should you include in this reproductive life plan?
So we have a journal here. Life's dynamic. Your plan can change, and that's fine, but start with a plan.
Kind of have an idea of what you think you want.
Exactly. Write some things that are important, really anticipating how many kids. What we're stressing out there currently is birth spacing, so it's important not to have those babies too close, because pregnancy does take a toll on the body and you want to be in optimal health. So we encourage people to wait 18 months between pregnancies. That reduces the risk of preterm labor and low birth weight. And then I've got a package of contraception, but there's many different ways of avoiding pregnancy when you're not ready for it, and so that's something to consider. And then of course some folic acid. I'm always plugging folic acid, because when you are planning to reproduce or have children, you want to definitely be taking folic acid.
So what if your reproductive life plan doesn't include children? Well, if you decide you don't want to have kids.
Well, that's an important decision, and so we have different types of contraception. Some are long-acting, reversible contraception. I would recommend most individuals use that first, and if they get to, say, 30, 35, and they are still definitely sure they're not going to go that route, then we have sterilization procedures.
I see. So but I like how you say, you know, at first, hold off on that, because sometimes people do change their minds. Yeah, especially from 20s to 30s.
Right?
Yeah, very, very different. And if you do want to have children, if you know, yes, this is definitely, what should you really address? Like time frames, when?
I think time frames are important. I think that we have done a really good job of either one, not thinking about it, denial's the worst, or two, over planning our life, and then we get into that late reproductive age. So the denial's not good, because that increases our unintended pregnancy rate, which right now is almost 50%. So that doesn't mean we don't want this child, it just means we didn't plan to have this child right now. And so that increases stress, it probably makes the pregnancy at higher risk. So unintended pregnancy is related to preterm birth as well. So stress in general, we know that it's not a good thing in our life, so having a good plan. So first, having the plan, and then the second thing is, if an unintended pregnancy does occur, to seek care as soon as possible.
Yeah, very, very important for that. And now let's say you are pregnant out there, you've just had a little baby. You guys have a great campaign starting right now, and maybe you want to have your baby up on a big billboard.
So we have a billboard campaign. We're asking everybody to submit photos for our billboard campaign and see your baby up in lights, and promoting our labor and delivery at Maricopa.
Very important. It's so good to see you.
You too.
You know, those are such great things to think about, because I think a lot of us just go along like it'll happen when it happens, but you need to kind of have an idea of at what point do you want to get more serious about having kids and to kind of get that plan in action.
And it's not, you know, for moms and dads out there and couples, it's not too early to start making a plan. That doesn't mean you're going to get pregnant tomorrow, but having a plan and an idea, and remembering that that can be dynamic and change.
And having that conversation, so important. And so that you're all on the same page, even more important. Thank you so much. If you would like more information about Maricopa Medical Center Labor and Delivery Department, please visit their website. It's Labor and Delivery Department. It's Maricopa Mommy, actually, maricopamommy.org, or you can call the number you see right there on your screen.